Hi guys, so I'm going to go over the list that we see here. With this particular face, it looks like it's got everything we need, and then I'll fill in the gaps, and we'll go individual videos, facial, arm muscles, torso muscles, so on and so forth. So the buccinator is the trumpeter, and this is a deep muscle that's in the cheek area, okay? It's underneath the masseter and the zygomaticus major that you see here. The depressor anguli oris pulls the mouth down, that's number 15. Orbicularis oris obviously is a circular muscle that goes around the mouth. There's temporalis is the muscle here, okay? This is in the temporal fossa of your temporal bone. Both the masseter and temporalis are chewing muscles, as in they raise the jaw up as they contract. And then again, the platysma, which isn't shown here, it's in other models. That platysma is a very thin, kind of a sliver of muscle that pulls the jaw down. The pterygoids, you cannot see anywhere, so you guys don't have to worry about those because I don't have a model for those guys. And then the superior and inferior oblique, those are eye muscles. There's the inferior oblique here. The superior oblique I can't really see. Just know what they do, okay? Pay attention to their action. If a muscle's not visible, that does not mean I cannot ask you about the action. I can always just name a muscle and ask you about the action. So make sure you're paying attention specifically to your list here. External glossal muscles and sternocleidomastoid. So these are the external glossals that we have here. These are just the tongue muscles. Those are the internal, you don't need to know, and those are the external. And then the sternocleidomastoid is sternum, clavicle, and then it inserts on the mastoid process of the temporal bone. Sternocleidomastoid. Okay? All right, go ahead and stop that. Okay, so here you guys, you want to pay attention to fascicular arrangement. Again, if we're in an A pattern here, that means internal, either oblique or intercostal. So here we have ribs. Here we have fascicles going in an A pattern on the ribs. Those are internal intercostals, okay? Here, little slivers going on. These are between the ribs, and those, in fact, are the external because now they're going in a V pattern, all right? This right here is the serratus interior. It's like serrated like a serrated knife. And here we have the start of the obliques. Again, they're going in a V pattern, so they have to be external obliques. And then I don't see internal obliques here. This is pec major, by the way. And of course, right under this muscle would be pec minor. Rectus abdominis is going to be coming straight down. Okay. And then we have, go ahead and push. So continuing on here, this is the rectus abdominis. I don't know why it's going up this high. This is inaccurate. That rectus abdominis inserts here at the xiphoid process along the bottom of the rib cage, and of course it originates from the pubic symphysis. And you can see this A. This A is going in an A frame, so that would be the internal obliques. And we have this little sliver going in a V frame. That represents the external obliques. And C here is going transversely, which is the same as on the inside. You see this muscle, that is the deepest of the abdominal muscles. That is the transverse abdominis. Okay, stop. Okay guys, so what we're gonna do here is I'm just gonna go over the ones that I see that you guys need to know. If I forget any, call them out. So this is, the torso model has this, this portion. Unfortunately, all of it's very, very deep. So what you're seeing here is only the superficial muscles. These are the trapezius muscles. These are the latissimus dorsi that we have here. Again, deltoids, and this is the start of the triceps brachii. This is the gluteus maximus that we have here. And these guys are the start of the hamstring muscle groups, which include rectus femoris. I'm sorry, I scratched that. Biceps femoris, long head only, semimembranosus and semitendinosus. I'll show you guys that on the leg. Then we have the occipital frontalis. This is the occipital belly of the occipital frontalis. And follow me over here. These are the spinous process of the thoracic vertebrae. These are interspinalis. These are very small very fine little muscles. Well, guess what? These are the transverse process of the vertebrae. These are the intertransversi, and these guys that pull and can cause it to rotate are called the rotators. These muscles are, again, very fine, but they are innervated by nerves, and a lot of times when you kink your back and it literally will bring you down, it's very often one of these very fine little muscles that are damaged very easily. So again, on this guy, since we have him here, this is the teres major that we have here, and this is the deltoid. Again, this is the start of the triceps. This is the serratus anterior on this guy here. You'll notice that we have the gluteus maximus, which is labeled D, and I guess another label D, that's the gluteus medius, and this is the piriformis muscle. This sciatic nerve goes in and disappears right underneath the piriformis muscle. This would be the tensor fascia latae. We can see that better on the leg model, so I'll show you guys that. And here we have, on the front, we have the iliacus and the psoas major, and together these form the iliopsoas group. That is the hip flexor group. Again, better seen on the leg model itself. By the way, this parachute structure here that's in both is the diaphragm. Here we have pectoralis major. We have deltoid, at least a portion of the deltoid. This is the anterior, middle, posterior deltoid. Again, this is the trapezius. And again, we have the sternocleidomastoid, that's sternum clavicle, that's running up into the mastoid process of the temporal bone. Rectus femoris is starting here, and the sartorius is here. Both of these muscles are better seen on the leg, so we'll show you that just on the next video. Okay, go ahead and stop it. Okay guys, so this is the leg model, and I'm just gonna go through here. This is the psoas major and iliacus are the first ones. Again, this is the iliacus, right? It's from the iliac fossa, and this is the psoas major, and that forms the iliopsoas group. In other words, the hip flexor group. And guess what? They flex the hip. In other words, they pull the thigh onto the abdomen. They pull it up. This is the longest muscle of the body. It's called the sartorius, and it's called the talar muscle because it also causes flexion of the leg and lateral rotation of the thigh. I'm just going to remove that for right now. Here's the tensor fascia latae that again runs into the iliotibial band. This whole aponeurosis is an IT band. Going posterior, this is the gluteus maximus. Of course, right under that, you're going to see the medius. You don't see the minimus. It's buried under that. And then you see the piriformis. Again, you know that the sciatic nerve coming up runs boop right into and underneath that piriformis muscle. All of these other guys, the glomerulus and the obturator internus, you don't need to know. So don't waste your time on that. Then we have hamstrings. Remember that, I always mess this up, semimembranosus and tendinosus are medial, where this is biceps femoris long head and short head are lateral on both of those sides. We don't need to go any deeper than that. This is the gracilis here. That means slender. Do you guys need to know yeah, you need to know the gracilis. And then here, that's the adductor magnus. That's the only one that's visible on this particular leg model. So we're going with the adductor magnus. Make sure you pay attention to what it does. Then we go around to the anterior portion and we have our quadricep muscles. Quad means four. Vastus medialis, vastus lateralis, rectus femoris, and then underneath the rectus femoris, directly under this, is going to be vastus intermedius. All four of those quads, again, originate here on the femur, except for the rectus femoris actually originates on AIIS, right? Anyways, they all come in, they merge into this patellar ligament, patellar tendon, then patellar ligament, and then boom, tibial tuberosity. These are our major leg extenders. Moving on down, we're missing the tibialis anterior. This is our main dorsiflexor of the foot. Pay attention to that. And the antagonistic muscle group to that little tiny sliver of a muscle. Compare that tibialis anterior to our plantar flexors, and there are big ones. These are gastrocnemius, both the medial and lateral head. And then deep to the gastrocnemius, which is labeled C here, that's the soleus muscle, Again, that means flat fish. I guess it looks like, you know, a flat fish, like a halibut or whatnot. And these, again, gastrocs are fast twitch muscle fibers. The soleus is a postural muscle. It's composed primarily of slow twitch muscle fibers. Let's see here. Boom, boom, boom. Hit them all. Okay, let's stop it.